from Parliament House by Veterans Affairs Minister Dan Tehan. Thank you so much for being with us, Minister. Now, this is, or has been said as to be the biggest funding boost to Veteran Affairs in decades. Why the main focus on mental health?
Well, obviously we had a report commissioned by the National Mental Health Commission earlier this year. That said that there were areas and there were gaps that we needed to work on. The Prime Minister, Malcolm Turnbull, has made it very clear that he thinks the best way we honour the service of those who have been before us, who have sacrificed for us, is to look after the veterans of today. And that is what we're doing in this package.
It's always very difficult for veterans to make that transition from military life to civilian life. Talk to us about the support that they currently have.
Well, there is transitional support there through the ADF, but obviously there is gaps. So what we want to do is make sure there is a transition path to employment for our veterans, and as part of this package, which we'll be announcing on Tuesday, for those veterans who have struggled with mental health, who have been hospitalised, we're going to look at targeted approaches to try and address how we can transition them better into civilian life, because it is young veterans who are the ones who are struggling most.
It's very interesting that you say that. Now, you've also said that this will be able to, or veterans will be able to access mental health services without needing to explain how their health issues are war-related. Is there some sort of issue around admitting that it is actually combat-related?
Well, one of the things which is very clear is that the earlier you can intervene when it comes to mental health issues, the better. So what we don't want is veterans having to prove that their mental health issues are related to their service. Now, if you've served one day, then you are eligible for the full suite of mental health treatments if you have served one day, and that's available to you free. It is demand-driven, completely uncapped in terms of the budget. So if you need the services and you have a mental health condition and you've served for one day in our military, the help will be there for you.
Minister, no doubt there will be a lot of people, a lot of veterans who will be welcoming this major funding. Now, the funding we know too will be going to improving other services as well. What else can veterans expect?
Well, there will be further investment in helping them to get employment. There will be further research as well into mental health conditions. What we're hoping to see is both Defence and the veterans community being world leaders, and especially leaders in Australia when it comes to mental health and the incidence of suicide. There will also be help for those who were involved with British nuclear tests and who went to Japan as part of the occupational force after Hiroshima. And also what we're looking to do is a big turnaround in claims times when it comes to the Department of Veterans Affairs. There's going to be a real investment in reducing the amount of time veterans will have to wait to access their claims, which has been another stress for our veterans.
Veterans Affairs Minister Dan Tehan, thank you for speaking with us.
Been a pleasure.